Hello, friends. At the outset, I would like to thank the organizing committee of Oculoplasty Association of India for giving me this opportunity. Today, I'll be talking on role of prosthetic scleral lenses. The indications are fixed dilated pupil, traumatic pupil, iris coloboma, and iridia, post-penetrating keratoplasty, corneal opacity, total corneal opacity, Phthisical eyeball, and purely cosmetic. Since it's an oxygen permeable scleral lens, this can fulfill the requirement of oxygen to the cornea and can help our patients see better and feel better with comfort. So many times, due to iatrogenic trauma or surgical intervention or neurological issues, patient land up with fixed dilated pupil. So even if patient has a visual potential, they can't see clearly due to photophobia and the glare which is caused because of the dilated pupil. This can be managed with the iris painted clear pupil scleral lenses or iris tinted scleral lenses with a clear pupil with a prescription. The scleral lens is prescribed or customized for such kind of patients like traumatic pupil, iatrogenic injuries, buttonhole iridectomy. So scleral lens can give a perfect optics, and then the extra glare can be managed with the clear pupil iris painting or iris tinted scleral lenses. Iris coloboma, the children's with coloboma may develop nystagmus and vision can be hampered as they grow, but can be managed with the clear pupil iris painted or iris tinted scleral lenses. Similarly, absence of iris by birth or by surgery can be again managed with the clear pupil iris painted scleral lenses. The picture doesn't show that clearly, but you can understand that it will definitely help. Post-penetrating keratoplasty patients also can be benefited with this, and many times this corneal opacity can be camouflaged with the iris tinted scleral lenses. Corneal opacities also can be managed with iris tinted scleral lenses. Total corneal opacities can be managed with the iris painted scleral lens with a black pupil. And Phthisical eyeball can be managed with little extra thick scleral lenses. Philosophy of fitting scleral lenses is basically we keep about 250 to 300 micron space over the cornea and limbus. The lens lands on the sclera. It is stable lens. It allows oxygen to pass through. It does not rotate. It does not dislocate. And it's absolutely comfortable. The vision is absolutely fine. And the area where iris painting is done is affected. The oxygen will not pass through that much area, but the central clear pupil and a peripheral, like say about 12 millimeter of iris painting, the landing zone is usually about 13.5 mm. So that 1.5 mm of ring and the central clear pupil allows about 30% of oxygen to pass through. So if you consider about 100 DK material, you will compromise 70% of the oxygen, but 30% of the oxygen will pass through the material. And cornea will have sufficient amount of oxygen. If you consider soft contact lenses, which gives about 20%, 20 DK oxygen transmissibility, whereas we are giving almost 30% or 30 DK oxygen transmissibility. If you consider 100 DK, you can go 120 DK, 160 or 200 DK material for prosthetic scleral lenses. And that will be sufficient for cornea to breathe properly. So you have a tinted lenses or painted lenses with a clear pupil or a black pupil. These are the options that you can have. We need a clear picture with iris apart, and we can see 360-degree details because this image is used for further processing. Flash photography is recommended so that only the reflection of the light remains in the center and we can see details of the iris. We can have iris samples to see which is close matching. The form has to be filled up what you need. So you want iris tinting or iris painting, or we can have a prosthetic impression scleral lenses, which is absolutely comfortable, and the guesswork is taken out of the situation. This is a video to show you how easy and simple it is to take an impression. This silicone is special silicone, which is non-toxic and does not need any anesthesia while taking the impression. So you fill up the tray with a special silicone and just hold the upper lid, ask patient to look down and insert it in the upper socket first, hold it straight, and then ask patient to look straight and retract the lower lid. So the whole tray goes upper fornix and lower fornix. Ask patient to look straight and wait for the silicone to set in. It takes about 40 seconds to 60 seconds, and it does not cause any temperature change. There is no oozing of oil or any sort. There is no irritation. You can see this Dr. Matthew Martin from USA had visited my clinic. That time we have taken this video. That's Maria, his wife, doing it for the first time. And you can see there is no pain, no discomfort, there is no watering, there is no redness. She's absolutely comfortable for the first time. And even Dr. Martin is doing this also for the first time. So it's absolutely simple. Anybody can do it. It's like dentistry. You take in dental impression, send it to the lab. Lab will make the required things and send it back to you. So similar thing now I'm offering, which is you can take an impression, send it to us with a picture, details, and dimensions, etc., and we'll try and match it closely. This impression, once it is done, we scan it to convert it into a digital file so that we can edit and modify whatever is required. What is editing is basically the fixation of the diameter that we need and elevating the area on the cornea. We keep about 250 to 300 micron of space on the cornea, and on the limbus about 150 microns. And we fill up with the normal saline and the lens is inserted so that it does not touch on the sensitive cornea and rest entirely on the sclera, and patient is absolutely comfortable. And you get amazing results. Patient is happy, you are happy. You can rehabilitate this kind of patients with prosthetic scleral lenses. Thank you very much for the opportunity.